Chapter 12, Development over the Lifespan. This is basically developmental psychology. So there are three sections to this: prenatal development, infancy and childhood, and adolescence and adulthood. So this first video is going to include a brief introduction, and then the first section, prenatal development, and we're going to look at genetics and sex determination, and then environmental influences on prenatal development. The first section talks a little bit briefly about the major issues and methods in developmental psychology. It's quite a large field. It crosses, because it's about how people develop across time, right? Changes in biological, physical, psychological, and behavioral processes across time. So many different fields will also include developmental psychology in their research or in things that they have to consider when looking at an issue or a problem. Developmental psychology is very much concerned or looks at the nature versus nurture, whether something's an effect of the environment or whether it was hereditary. They do a lot of twin studies to look at that. Developmental psychology also looks a lot, say, at critical and sensitive time periods. We talked a little bit about that before when we were talking about developing speech, right? How youth develop speech. We talked about a little bit as well in terms of learning a second language, right? It's better to learn a second language when children, when you're a child, when you're very young. And then as we get older, it gets harder and harder to acquire. We can learn the vocabulary and we can memorize vocabulary, but to learn all of the small little nuances of a language becomes more difficult as we get older. Then basically, and then looking at like developmental functions, so how processes change. And they can change in a whole bunch of different ways, right? So sometimes there is no change and things remain constant. Sometimes there's like gradual changes across time. Things happen in different stages of development. Some processes emerge early and then they disappear and they reemerge later in life. So it's just how things come, how they arise, and then possibly how they disappear later on. That sounds a little confusing, but it will make sense as we go through the chapter. So how do we look at these things? So we're just going to talk briefly about the research design terminology. Cohort, as they talk about in the book, cohort is a group born at the same time. Okay, so if you're going to have a cohort, and here's two studies over here, you're going to have your control group, you're going to have your experimental group. These groups are called cohorts sometimes, right? Then there's basically three types of designs that are mentioned here. There's a cross-sectional design, where participants of different ages are studied at the same time. And there's a chart later to sort of make that more clear. A longitudinal design, where it's the same cohort, the same group of, say, 5-year-olds that are tested for age 5, 10, 15, 20, 25, 30, right? And then there's a sequential design where you test several cohorts as they age. And like I said, that's going to make sense in just a couple of slides. So which one do you use? Thing is, each of these three, the cross-sectional, the longitudinal, and the sequential design, they all have their strengths and they have their weaknesses. So depending on what your research question is, and depending on what kind of resources you have, that sort of helps determine which one you're going to use, right? I'm going to jump down to this slide for a second. So this is a cross-sectional design. So let's say that you're trying to I don't know, the language acquisition, right? So if it's a cross-sectional design and you want to know how that changes across time, then you're going to use a group of 10-year-olds, a group of 20, and a group of 60, right? And you're testing them all at the same time. So this group is representative of all the people of that age. This group is representative of all the people that are 25 or 30 or whatever I said they were. So you're done in in that year. Whereas a longitudinal design, you're going to take the same group, this 10-year-old here, you're going to have 100 of them, and you're going to study them in 2011 and 2031 and 2061. You can see that that takes a heck of a lot longer. And then there's other problems that arise with that. So let's go back here. So the cross-sectional design, different cohorts grow up in different time periods. These different groups, you're saying that this represents this age group and this person represents this age group. They grew up in different times and have different experiences as well. So you can't for sure say that the change is just to do with age, because there's other things, other life experiences that they've had that could possibly, probably did influence the change. Okay. The problem with the longitudinal, I'll go back here, very time consuming, people drop out, and change is generalizable to all. So if you've got a group of 100 here, and by the time you get to 2031, this could be down to 70. And by the time you get to 2061, this could be down to 30, right? So now while you're sure that they have the same life experiences, right? You've solved for that. They have the same life experiences. Now you have other problems such as attrition, people dropping out, people moving away, losing interest, dying, all sorts of things, right? Also, it's very, very expensive tracking these people over time like that. Okay. So the first section, prenatal development, there's 3 stages. So stage 1 is the first 2 weeks, right? That's the germinal stage. Stage 2, embryonic stage, that is from the 2nd week to the 8th week, right? And that's when the placenta and the umbilical cord develop. And then stage 3 is the fetal stage. That begins at the 9th week, and that goes up to, from the 9th week right to the end, right? At age 28 weeks, that is considered the age of viability when the fetus could survive outside of the womb. So in your text, there's a few extra notes to do with each of the stages, things that develop during that time that you should take a look at. Okay, the next section, talking about genetics and sex determination. So what determines whether a baby is male or female? So males have 23 chromosomes, right? And females have 23 chromosomes. So what they'll have is females will have 23 X chromosomes, whereas males will have 22 X chromosomes and 1 Y. Okay, the Y chromosome contains TDF, which is the testes determining factor. Okay, and that's what triggers male sexual development. It initiates the development of testes and it secretes androgens. So the critical period is at about 6 to 8 weeks. Are there androgens or not, right? If there's no androgens, then there was no Y chromosome, and therefore it's all X's, and therefore it's female. Okay, so you can see here, you've got your 22 pairs here, and your 23rd pair. If there's 2 X's, it's female, and if there was a Y, then it's male. The next section The next section talks about environmental influences and teratogens. Basically, these are environmental agents that may cause abnormal fetal development, such as alcohol, cocaine, and some other ones we're going to talk about. Other environmental influences include maternal malnutrition, which can result in miscarriage, premature birth, stillbirth, impaired brain development. Maternal stress, so too much stress hormone can result in premature birth, infant irritability, and attentional deficits. And then lastly, sexually transmitted diseases, which can pass from the mother to the fetus and produce things like brain damage, blindness, deafness. The impairments or the effect depends, of course, on what disease was passed on. So first we're going to talk about the fetal alcohol spectrum disorders that basically involve a range of from mild to severe cognitive, behavioral, and physical deficits caused by prenatal exposure to alcohol. FAS involves a cluster of severe developmental abnormalities. You can see here some FAS, children who suffer from fetal alcohol syndrome not only look different, but their brains are underdeveloped compared to children who did not have alcohol during the prenatal development. You can see here facial characteristics: small eye opening, smooth philtrum, and thin upper lip. Psychological and social impairments, including intellectual disability, attentional and perceptual deficits, impulsivity, and poor social skills. There's a wide range of effects. How much alcohol does it take to have these effects? The threshold is not known, however. They estimate that between 33 and 50% of children born to alcoholic mothers suffer from fetal alcohol syndrome. Other teratogens is nicotine, caffeine, heroin, cocaine, cannabis. Okay. So for nicotine, increased risk of miscarriage, premature birth, low birth weight, cleft palate, and respiratory infections. Effects of caffeine may include it may influence fetal brain development and affect embryonic development of the cerebral cortex and hippocampus. Heroin and cocaine, they're often born addicted, so they go through all of the withdrawal symptoms, which can be dangerous. Cannabis, less research, less known about it. It is expected to affect the fetal brain function and organ systems, but exactly what the impact is unknown right now. This next slide, this is not in your texts and will not be on the test, but I am putting this here because vaping is, it's just everywhere, and people incorrectly believe that somehow vaping is healthier or less dangerous than cigarette smoking. But as you can see here, there are many to do with prenatal development, at least. There's many neurobiological, pulmonary, and cardiovascular effects on the fetus. So I have this here for you to take a look at. Yeah, but as I said, this is not on the test. This is just for your own knowledge, okay? So that's it for the first section, prenatal development. We talked about genetics and sex determination, what makes a boy, what makes a girl. And then we talked about environmental influences. Yeah. The next section, video 2, infancy and childhood, is a much longer section, so I'm going to do that in a separate video. So I will see you there.